Alaska Free CNA Practice Test with Answers 180 Questions Real Exam Review. Question 1. After reporting a red area on a resident's hip, the nursing assistant should expect what? Option A. The resident will be placed on short-term bed rest. Option B. The area will be covered with a protective dressing. Option C. The area will need frequent massage with lotion. Option D. The resident should be positioned to avoid pressure on the area. The correct answer is option D. The resident should be positioned to avoid pressure on the area. Keeping weight off a reddened area is the most effective way to prevent a stage 1 pressure injury from worsening. Question 2. It is most important for the nursing assistant to check water temperature before doing what? Option A. Assisting the resident with mouth care. Option B. Soaking the resident's feet for foot care. Option C. Giving the resident a bed bath. Option D. Washing their own hands. The correct answer is option B. Soaking the resident's feet for foot care. Soaking involves prolonged contact with water. Checking the temperature prevents thermal injury to the skin. Question 3. A resident has pain in the arms and jaw and is sweating. What should you do? Option A. Check the arms and jaw for possible injury. Option B. Check the care plan to see if they are on heart precautions. Option C. Ask if they ate something that upset their stomach. Option D. Recognize the seriousness and report immediately. The correct answer is option D. Recognize the seriousness and report immediately. Pain in the jaw and arms, along with sweating, are classic signs of a heart attack. Question 4. You notice a resident is eating very little of their lunch. What is the most important action? Option A. Check if the resident was snacking before the meal. Option B. Ask if the resident would like something else to eat. Option C. Remind the resident that dinner is several hours away. Option D. Check when the resident last had a bowel movement. The correct answer is option B. Ask if the resident would like something else to eat. Identifying and offering preferred alternatives ensures the resident maintains adequate nutritional intake. Question 5. To help prevent confused residents from accidentally leaving the home, the facility may do what? Option A. Block exit doors. Option B. Restrain residents. Option C. Place large stop signs on doors. Option D. Keep confused residents in their rooms. The correct answer is option C. Place large stop signs on doors. Visual cues like stop signs or disguised doors are safe ways to deter elopement without using physical restraints. Question 6. What is most important to observe when a resident wears elastic compression stockings? Option A. The resident's shoe fit. Option B. The resident's pulse rate. Option C. The way the resident walks. Option D. The color of the resident's toes. The correct answer is option D. The color of the resident's toes. Checking toe color allows the assistant to monitor for adequate blood circulation while the stockings are in place. Question 7. When cleaning, which area of the body is it most important to change the spot on the washcloth for each stroke? Option A. Arms and hands. Option B. Abdominal area. Option C. Face and neck. Option D. Perineal area. The correct answer is option D. Perineal area. Changing the washcloth area during perineal care prevents the spread of bacteria from one area to another. Question 8. A resident is slow getting dressed and misses her friends at breakfast. What should you do? Option A. Set out clothing that they can dress in more quickly. Option B. Address the resident yourself to make it faster. Option C. Ask if there is any help the resident would like in the morning. Option D. Remind the resident that friends will be at activities later. The correct answer is option C. Ask if there is any help the resident would like in the morning. Assisting the resident based on their preference helps them meet their social goals while maintaining independence. Question 9. A trash can in a resident's room is on fire. What should the nursing assistant do first? Option A. Use the resident's pitcher of water to put out the fire. Option B. Open the window to get the smoke out of the room. Option C. Yell fire along with the room number. Option D. Remove the resident from the room. The correct answer is option D. Remove the resident from the room. Removing the person from immediate danger is the first and most critical step of any fire response plan. Question 10. A resident with a feeding tube is scheduled for a shower. What is the appropriate response? Option A. Disconnect the feeding tube temporarily to give the shower. Option B. Protect the pump with a plastic bag. Option C. Ask the charge nurse for assistance with the pump. Option D. Give the resident a bed bath instead. The correct answer is option C. Ask the charge nurse for assistance with the pump. A nursing assistant is not authorized to manipulate feeding pumps. The nurse must manage the equipment. Question 11. What is the normal medical appearance of healthy urine? Option A. Clear. Option B. Cloudy. Option C. Dark yellow. Option D is strong smelling. The correct answer is option A. Clear. Healthy urine should be clear and pale yellow. Cloudiness or strong odors can indicate an infection. Question 12. A resident with a history of falls is found on the floor and is crying. What do you do first? Option A. Call for help while keeping the resident calm. Option B. Check for injuries while asking how they fell. Option C. Place a pillow under the head and cover with a blanket. Option D. Consider if the resident is trying to get attention. The correct answer is option A. Call for help while keeping the resident calm. Emergency protocols require calling for help immediately to ensure a professional assessment is performed. Question 13. A resident's hands shake while drinking, causing spills. What is the best response? Option A. Thicken the liquid so it will not spill. Option B. Place a clothing protector on the resident. Option C. Seat the resident with others who also spill. Option D. Suggest that the resident might do well with a cup with a lid. The correct answer is option D. Suggest that the resident might do well with a cup with a lid. Adaptive devices like cups with lids support independence while minimizing messes and embarrassment. Question 14. True or false, a nursing assistant should never exercise a joint past the point of pain. Option A. True. Option B. False. The correct answer is option A. True. Passive range of motion should always stop at the first sign of resistance or resident discomfort. Question 15. True or false, hand washing should be performed for at least 20 seconds. Option A. True. Option B. False. The correct answer is option A. True. 20 seconds of scrubbing is necessary to mechanically remove pathogens from the surface of the skin. Question 16. True or false, you should use hot water when cleaning a resident's dentures. Option A. True. Option B. False. The correct answer is option B. False. Hot water can warp the plastic material of dentures. Lukewarm or cool water should always be used. Question 17. True or false, a nursing assistant can legally give a resident their daily medications. Option A. True. Option B. False. The correct answer is option B. False. Medication administration is restricted to licensed nurses or certified medication technicians. Question 18. True or false, incontinence is a normal and expected part of the aging process. Option A. True. Option B. False. The correct answer is option B. False. While more common in the elderly, incontinence is not a normal part of aging and often has treatable causes. Question 19. True or false, you should always knock before entering a resident's room. Option A. True. Option B. False. The correct answer is option A. True. Knocking is a sign of respect for the resident's privacy and their personal living space. Question 20. True or false, a gait belt should be applied over the resident's clothing. Option A. True. Option B. False. The correct answer is option A. True. Applying a gait belt over clothing prevents skin irritation and shearing during transfers. Question 21. True or false, it is acceptable to share a resident's medical status with their best friend. Option A. True. Option B. False. The correct answer is option B. False. Privacy laws forbid sharing medical information with anyone not on the healthcare team without the resident's consent. Question 22. True or false, a resident has the right to refuse a bath? Option A, true. Option B, false. The correct answer is option A, true. The right to refuse care is a fundamental part of the resident's Bill of Rights. Question 23. True or false, when shaving a resident, you should shave in the opposite direction of hair growth? Option A, true. Option B, false. The correct answer is option B, false. Shaving in the direction of hair growth prevents skin irritation, nicks, and ingrown hairs. Question 24. True or false, mouth care for an unconscious resident should be done every 2 hours? Option A, true. Option B, false. The correct answer is option A, true. Frequent care is necessary to prevent infection and keep the oral mucosa from drying out and cracking. Question 25. True or false, a Foley catheter bag should be hung on the bed rail? Option A, true. Option B, false. The correct answer is option B, false. The bag must be hung on the bed frame, as moving side rails can pull on the catheter and cause injury. Question 26. True or false, standard precautions should be used for all residents regardless of their diagnosis? Option A, true. Option B, false. The correct answer is option A, true. Standard precautions assume all body fluids are potentially infectious and protect both staff and residents. Question 27. True or false, a nursing assistant is responsible for providing emotional support to the resident? Option A, true. Option B, false. The correct answer is option A, true. Psychosocial care is a core duty of the nursing assistant to ensure the whole person is cared for. Question 28. True or false, you should use a paper towel to turn off the water faucet after washing your hands? Option A, true. Option B, false. The correct answer is option A, true. Using a dry paper towel prevents your clean hands from picking up germs from the dirty faucet handle. Question 29. True or false, chronic illness refers to a sudden illness from which the person is expected to recover? Option A, true. Option B, false. The correct answer is option B, false. An ongoing, long-term illness with no known cure is defined as a chronic illness. Question 30. True or false, the rectum is the most accurate site for taking a temperature? Option A, true. Option B, false. The correct answer is option A, true. Rectal temperatures are closest to the body's actual core temperature. Question 31. True or false, you should never put anything in the mouth of a person having a seizure? Option A, true. Option B, false. The correct answer is option A, true. Placing items in the mouth can cause broken teeth, choking, or injury to the caregiver. Question 32. True or false, when a resident is in a wheelchair, the drainage bag should be placed on the floor? Option A, true. Option B, false. The correct answer is option B, false. The bag should be attached to the chair frame and kept off the floor to prevent contamination. Question 33. True or false, a nursing assistant may cut the toenails of a diabetic resident? Option A, true. Option B, false. The correct answer is option B, false. Due to high infection risks, nail care for diabetic residents is usually performed by a nurse or podiatrist. Question 34. True or false, a nursing assistant should report if a resident has not had a bowel movement for 3 days? Option A, true. Option B, false. The correct answer is option A, true. Monitoring elimination patterns is critical for preventing complications like fecal impaction. Question 35. True or false, it is acceptable to talk about a resident's behavior in the staff break room? Option A, true. Option B, false. The correct answer is option B, false. Discussing resident details in public or non-clinical areas is a violation of HIPAA privacy laws. Question 36. True or false, the last sense a dying person usually loses is the sense of hearing? Option A, true. Option B, false. The correct answer is option A, true. It is believed that hearing persists even after a person has become unresponsive during the dying process. Question 37. True or false, you should always use a draw sheet to move a resident up in bed? Option A, true. Option B, false. The correct answer is option A, true. A draw sheet helps lift the resident and prevents skin shearing caused by sliding. Question 38. True or false, hypertension is the medical term for low blood pressure? Option A, true. Option B, false. The correct answer is option B, false. Hypertension refers to high blood pressure, hypotension refers to low blood pressure.